guest this next hour, Kecia Gaither, and she is double-boarded. She's a double-boarded physician in OBGYN and maternal fetal medicine, and she also holds a master's degree in public health, so I'm very jealous of her, and I'm going to be especially mean to her. No, she's a perinatal consultant and women's health expert. Gaither's expert is grounded in both research and her professional experience in caring for women with diabetes, HIV, and obesity and pregnancy. So we're so happy that she was able to come onto the show and glad to have her here. Hi, Kecia.
Hey there, how are you? Thank you so much for having me.
Oh, we have a lot of energy here between the two of us. I'm so excited. Hi, my darling. I'm so jealous. You have a master's in public health. I'm going to have to beat you to a pulp.
A lot of work.
I know. So what should we talk about today? You want to talk about ovulation a little bit? I think that might be a good place to start.
Absolutely.
And our lines are open, and if anybody has any questions about obesity and pregnancy, diabetes, HIV, you're not doing anything on Zika, are you?
Actually, I just did a series of lectures a couple of weeks ago on Zika.
Okay, great, because I saw the WHO didn't make it now. They took it off of their epidemic list or something wackadoodle. But it doesn't mean that you shouldn't be afraid to, you shouldn't be like free for all. I mean, I still think you should still take precautions, and my patients asked me that today. So
got a lot of patients with Zika.
Yeah, You do, not me. Not me. I had one that was in Florida but didn't get it, so I was very happy about that. So anybody that has any questions, we are taking your calls to 212. I'm already at 1-877-NYU-DOCS. That's 1-877-698-3627. So let's talk about. I had a couple of Mirena calls today, Mirena and Paragon. One of my patients asked me about the Mirena, and she wanted to try and become pregnant. What's your thought on that? When does ovulation usually come back after being on the Mirena? I told them 3 to 6 months.
Exactly. That's exactly what I was going to say. About 3 to 6 months, give your body a chance to acclimate itself back to its regular hormonal pattern, and then try around 3 to 6 months after you have it removed. Certainly, if you're trying to get pregnant, I always advise my ladies in the preconceptual period to take folic acid, which helps in the development of the baby's brain and spinal cord. So,
so important. Yeah. Mm-hmm. Yes, I said, even though it's going to take 3 to 6 months, you got to go for your preconceptual counseling, once you have that IUD pulled out, because you never really know for sure. But I do say on average that's what it is.
Mm-hmm. Absolutely.
So you had some interesting things about, the signs of ovulation, which I agree with you totally. So, I love that sense of smell. So what's going on with that?
Well, the thing is, humans are animals, and like animals, we put out scents, and those scents are called pheromones. And when women are ovulating, they have a heightened sense of smell to the pheromones that the man puts out. And that particular pheromone is called androstenone. So, we can kind of smell a virile male, let's put it that way. Our sense of smell is heightened, and we're more attracted to virile men during our ovulatory period.
That's really, I love that, interesting. And then you said that the cholesterol drops. Why does the cholesterol drop? What's happening chemically in the body that makes the cholesterol drop?
Well, really, the menstrual cycle is nothing more than a bunch of hormones going up and down. So during the ovulatory phase, your estrogen and your progesterone kind of drop. And this, in part, kind of decreases the synthesis, or it decreases the synthesis of the cholesterol in your body. So during this point in time, you might see a little drop.
Right, of the cholesterol. That's interesting. And I love when you talk about the blushing beauty. I totally agree with that. You said blushing beauty, due to the increased hormone levels, the face becomes sort of more...
A little flushed,
yeah. Because I know when I'm not ovulating anymore, we become pale weeds. But I didn't want to get into that.
No, but, when you're ovulating, I mean, these are all kinds of signs
that attract
that
you
your
to the
body
male.
exactly.
Yes.
So the male is more attracted to you. You know, your skin is a little dewy and